Hello, everyone. This is Dr. Joanna Nixon.
I am Dr. Vilma Pacheco Barcia, and this is Open Doors Podcast, two women scientists driven by curiosity, evidence, and compassion.
Hello, everyone, and welcome back to Open Doors, the podcast where we explore professional well-being in oncology and beyond, one conversation at a time. Today, we are truly delighted and honored to have Dr. Sergio Cifuentes with us, who is a passionate advocate for patient rights, equality, equitable access to cancer care. His extensive experience across Latin America and Europe gives us a unique opportunity to talk about his perspective on resilience, collaboration, and his ongoing challenges in the global oncology.
Dr. Sergio Cifuentes Canaval, he's a medical oncologist with a clinical and research focus on breast and gastrointestinal cancers. Committed to addressing inequities in cancer care, he works to increase the representation of underserved populations, particularly in Latin America, in clinical trials and research initiatives. Throughout his career, he has coordinated phase 3 clinical trials, contributed to international oncology networks, and developed educational programs for oncologists. In 2025, he was selected as an ASCO IDEA International Development and Educational Award recipient, recognizing his commitment to advancing global oncology through research, mentorship, and cross-border collaboration.
Thank you. Thank you so much for this space. When I hear that introduction, I feel that I rode a long way to being here. But it's nice to collaborate with you in this important topic and share some thoughts about mental health, about career, early career, with all my colleagues and with you in this space. Thank you so much.
Thanks, Sergio. Thank you for being here. Residency is challenging for everyone, including us. But how each person copes can be so different. We know from Shanafeld's research that more than half of trainees report high levels of burnout. In your experience, did you see signs of this in yourself or among your colleagues?
Yes, I saw these signs along for all my career, I think, because when you are in a limited space like Latin America, you always have this thought about I can do it, and this is important because this is the mindset that all these countries have. These limited opportunities for us make us like warriors, I think is the word. And when you finish your career, this is an important thought for you because you don't see many opportunities for your development. When you start the residence, you have to take the only opportunity that you have. You don't have the opportunity to choose for the 90% of the residents. You have only chance, and this is your only chance. And when you start the residence, you see that this is not a color dream that you imagined before. You have the patients, you have the attendants, you have the system, and this mindset of warrior bring this burden in your shoulders that put in that way that you always fighting, and this is hard for the residents in Latin America. We always fight with the system. We always fight with the limited opportunities, and this is hard for our minds, and this is difficult to recognize for people outside, for Latin American countries, because this mindset is different for people outside of our continent. You have many opportunities, you have many mentors in your career, but here we have limited opportunity for all of that. And I feel that always during my 5 years residency, because this feeling about I want to commit with being a medical oncologist. Not you only have the opportunity to take your residency, go outside, and only have your consult. I have always this thought about doing something else. And this cost during the residency a little bit more, like the other residents. And I feel that that was a heavy burden for many years until I complete, until I bring the light for some ideas, and I saw that these ideas can be real. But yes, I saw in myself and I saw burden in my teammates.
Sergio, thank you so much for sharing that so openly. Actually, I am from Panama. I've been living here for many years. I did my residency here in Spain, and I don't have many friends that have done medicine, and I don't have any friend that has done medical oncology, so I did not have any idea of all that. We've focused so much on professional well-being and the importance of mentorship. In previous episodes, actually, we've talked about this. Joanna, it must be really difficult to find yourself in that place because we have, like, when we're trainees, long weeks and endless responsibilities that can really take a real toll. So if we add to that burden what you've explained, Sergio, it's deeply concerning. Were there any small habits or daily routines that helped you stay grounded and protect your mental and physical well being, even during your busiest rotations?
I want to be so clear about this. This is my early approach to the mental health. This is not a kind of topic that you have always in mind. You always hear about mental health and all of that kind of stuff. But outside of the medical practice, inside the medical practice is difficult to take this in mind. I think that will be changed in the next year, because this is an important topic for residency and for fellows in Latin America. But unfortunately, I didn't have the resource until that I gain a little bit more time for think about this topic. And this is my reality. It's different for other persons I know. Because you always be was in that challenge that you don't have time. And this is that kind of will that you only have time for sleep, for study, for make different things around your medical practice, and that is all. I have my refuge, and this is my family. I have recently get married, and my wife lived this challenging time with me. And if I think about mental health, for me is spend time with my wife, spend time talking about the challenge of the day, talking about the difficult that was in that time taking my residency, have a half part job for pay my stay in Mexico, and that's all that I have. Maybe in the last year of my residency was the worst for my mental health, and I have to take care about that, taking time with a psychologist consultation about that, because was really hard at that time, that you feel that you paralyzed with that anxiety that you feel sometimes in the day to day, and that was hard. And I think the fellows in Latin America, I was privileged because I take this opportunity with a psychologist for a few months, but many people don't have that opportunity, and the outcome is worst for the patients, worst for ourselves, worst for everything. Even this kind of blindness about mental health. Mexico have a high rate of death during the residency, during even uh, in the major residency like pediatricians, like GI and internal medicine. And this is difficult for us to take time for our mental health. Unfortunately, I don't have this routine for mental health. I'm trying to write a little bit more, but I don't have an answer for this. I have to recognize that I'm doing so bad during many years of my career development. Right now, I try to take more time for my mental health, for my physical health, but this is because I have a little bit more time for that. But during the residency, it's hard to take time for this topic.
Thanks, Sergio. This is very powerful, and thank you for sharing and being so transparent about things. It's frequently not easy to share personal experiences around sensitive topics. So I think a lot of the listeners might be able to resonate. And what we all know is that burnout is not something that happens overnight. Frequently, it just builds up, and one day the engines shut, and people feel as if they run out of battery and they can't really function anymore. It comes quietly. And when it hits that point, it is pretty serious. You spoke about recognizing some signs. How did you recognize these warning signs in yourself? What was the alarm there?
Yeah, I think the alarm for me was when I don't enjoy it that I'm doing. Medical oncology was my dream. During my darkest times in the I don't enjoy it. I don't want to do it anymore. Even was a repetitive thought about resign. This is what I want. This is what I this is for this was all these troubles, all these challenge of these all these battles because when you saw my background, I'm born in Colombia, in a little in a little city in Colombia, in the north of Colombia. Then I have to go outside of my city, my home, because we don't have many opportunities there. Go to another city and then work for 8 years and looking for opportunities for being resident in internal medicine, and then go outside to another country like Mexico for being residents in internal medicine, then my fellowship in oncology. This is hard. And when you fight with these redundant thoughts about what I'm doing, okay, and facing the pandemic, my first week like residence was my inauguration to the pandemic. I have I have 2 years in pandemic during internal medicine, then go to medical oncology, and then feel this burnout during my second year of residency. It was really a really challenge for me, really challenge for my partner, for my wife right now, because we only thought about the burnout is for the person, but people around you feel your burnout and feel the consequence that you have always angry, always sad, always that you don't have energy for anything. And the couples of the residents feel that, the family feel that, even our dogs feel that, because we don't want walk with our dogs, or with any animal that we have in our house. And this is hard. And when I hear this question, I remember that this is what the first sign for me, that you don't have any energy for anything, and you don't enjoy
Yeah.
that you live in this dream that you have.
Yeah, and actually, what you're describing, Sergio, it's the emotional exhaustion that won't let you keep going in that way. And I think it's very important what you're explaining, that for one side, our like your refugee was your family, that was the way you felt better. But on the other hand, all that burnout you were feeling, you also felt that it had an print in them, like an impact in your
Yes.
family and your loved ones. Some training programs now try to address this by adding wellness or mindfulness sessions. But it's true that doing mindfulness can be difficult in that moment, but it has shown to help. You've explained that during your residency you did not have that well-being support. It's true that it's something that we're not used to talk. Hopefully in the future we'll see more professional well-being being talked about. For now we're trying to build those strategies. I think, as Joanna was saying, many listeners will probably resonate with all that you're explaining. And I'm also worried about those young oncologists or young doctors that feel guilty for taking a break. Because when we're feeling the way you're explaining, the overwhelming feeling of burnout and stress, what is usually recommended is to try to find the well-being side, the resilient side, and maybe make a pause, make a break, and just as you did, Sergio, find a perspective. What would you say to reassure young doctors and tell them that it's okay to pause and take care for themselves?
I want to be clear in this. I'm being part of this idea that you take care about yourself, take a pass, and all of that. But the system in Latin America don't permit that because uh, we have only 1 month of vacation during a year. And when I saw different cases about burnout, a severe burnout, depression, and all of that, hospitals that only can offer to the residents is take your vacations, think about it, and then come back in 2 weeks, talk about that. How do you feel? You feel okay? You can do it? Okay, let's go. But this is not the solution, you know? This is not a real solution for the residents. For our doctors, we have a doctors living these depressions, these severe the depressions during the residency, and attend patients in the worst time of this life, their life, and this is not a good solution. This is only part of the solution because if you don't have any professional companion during that time, you don't have the global solution. And I think for Latin America, we can implement a kind of solution. We have a program of palliative care during the residency. This is our companionship during all our residency. We know perfectly how this program work for the patient, but I think that we can manage this burnout during the residency with a partnership, receive this kind of support during our residency with our fellows or the team, with the palliative care team. They have a psychologist in that team that can companion the fellow residents in oncology, in medical oncology field during this time. Was I saw during my residency when we have it a really bad uh, case of burnout or depression, we ask for the our mm, palliative care team that we can that they can take cards in this case, and that work in many cases, not in all the cases because they have a lot of work to do. And you know we can manage. I really is only part of the solution.
Yes, and stressing that yes, it's okay not to be okay, and it's okay to pause. Holiday sometimes is not panacea to a burnout prevention, but it's good to take our holidays and enjoy ourselves if possible. So looking back now with a bit of more distance from things, Sergio, is there anything you think you could have done differently to care better for your own well-being during residency? So we are in the 20%, as Tate Schanafeld says, that is around our own, in our circle of control. Anything that you could have done differently?
Yes, I think I completely forget about doing exercise during my medical residency. I think that is important for my mental health. I enjoy so much the running morning sessions. This is a kind of circle, you know. You feel tired, you don't doing any exercise, and you feel bad about that, and this is an infinite cycle, you know, that you have to how you address to go outside of that cycle, you know. Maybe maybe this doing exercise during my residency maybe change, maybe was changing my mind about burnout is one. Writing, that is another another part, another important part to address the burnout that I saw in the retrospective, that I can do it during the residency, you know, and talk more about this, because you feel bad when you say, hey, I'm really tired, hey, I'm really feel burnout right now. How do you address this with another colleagues? Maybe look for help early, not wait that is feel really burned out, you know, really feel bad and feel kind of depression, you know. I don't I doing that. If I have the opportunity to doing another kind of stuff, I'm doing that, and this is my advice for people that feel burnout right now during their residency.
Winning the ASCO IDEA Award is incredibly special, isn't it? And it's something that many, many young oncologists dream of, but they don't really know much about it. So, for anyone listening who hasn't heard of it, could you explain what the award is, what it means for a young oncologist?
Yes, of course. The ASCO idea was a little bit light during my residency and was my happy time, you know. The ASCO idea is an international development education award. You can participate during your residency, but you can participate during your early career development. And this is an important program because this is an opportunity to take some exposure, not only for you, but take exposure about leadership, about how other people in the world address the same challenge that you have. And taking part of this program bring broad vision about oncology in the world. And you can take some ideas around the world and take to your country and take to your practice, and doing some kind of uh, uh, special ideas to your ambient, to your community. And this is an important program for oncologists. I want to many oncologists in Latin America take time to participate in this program, because this exposure, not only for the oncologists but for the region, is important to being representing in this kind of program, in this kind of international program, because we have voice in Latin America that that medical society should hear about how we have many problems, but how we can address this problem. And you and many oncology society take this voice in count for other programs, you know. And this is important because Latin America taking more relevant spaces in the medical societies, like an ASCO. Maybe ESMO is a little bit more challenging for our in Latin America for the travels. But this is important that we have representation in this program, in this society, because it's the early career that you can develop in these societies. I'm so happy to take part of this program. This is my first time that I have a mentor during a complete year. And this is challenge because you don't have in mind what happened with a mentor, what you talk about with a mentor, you know. The first time that I hear that I have a mentor during 1 year, what I can do with one person during a year, asking for what can I do, what can I address this. But this is important for take this time to learn to be a mentee, but how to be a mentor for for another oncologist, and this is important resource that we have in the ASCO IDEA. The other part, I think, is in the same importance of have a mentor is the leadership development, because in Latin America we don't have leadership that be prepared for being a leader. They are key opinion leader for only because they practice, but they don't study for be a leadership in medical oncology. And this is important that we have more medical oncologists in the practice in Latin America, being leader for another oncologist, being mentor for another oncologist. And maybe in 10, 20 years, we have a community that can make real impact in these societies, in this publication. And that is a goal that I have, that be aware about what we can do. Okay, we have challenge, but how we address this challenge. And the ASCO IDEA program is a good program to address how to manage all of this, the networking, the mentorship, and the leadership.
This is beautiful, Sergio. Congratulations. You should be
Thank you.
very proud of all the work you've done to get here. I would like to make a recap and say it's a beautiful bridge what we've just seen. So we've talked about burnout, how difficult it is to manage situations in Latin America due to the fact that you don't feel that support. And I think it's very good that we have initiatives like ASCO IDEA Award that values also the role of the mentor, which is something that we've spoke in the previous episode, where we see how important is our relationships. Joanna, we've talked about this in previous episodes also, and how to feel supported, to open doors to new knowledge and the growth mindset. I said, Hugh, you've crafted beautifully these ideas right now. And something that comes to my mind when you explain the difficulties to achieve the ASCO IDEA Award is that applying for something so competitive can actually feel intimidating. It's something totally new where you're going to expose your CV, your curriculum, your why you want to go. It takes a lot of steps to go there. What inspired you to go for it and put yourself forward with this opportunity?
I have an attendant in my clinic, in my hospital, that always says something that is a mantra right now for me. What, why we can do that? And this is an important mantra for me, because we only have in mind always that only people outside of Latin America can do this kind of things. This program is not for us. This program is for people that have better CVs. This program is for people that have better communication skills, that people that speak English better than us. And you hear, this is my white elephant in all my conversations. That is my level of English. And this is a repetitive question about this. The most important challenge for me was my communication skills and my language skills in English. That was important, but is expose my CV to a review for people that you didn't know, for people that have more publications than you, and take part of this kind of competition. It's important for us in Latin America to forget about that we can do it. We can't do it. Change that mind that it is possible. It's not always possible, but you have the opportunity to be exposure to a competitive ambient, to a competitive programs. And when you do it, you don't win only for you. You win for your partners, you win for your society, you win for your country. And this kind of exposure that you can do it, you can be part of these programs, is a kind of inspirational for another medical oncologists in the field, that they can that always feel that you can't do it being part of these ideas, you can't be part of these kind of programs. And this is the best part of winning something, that you can inspire some other peoples in your field.
I love the can do attitude, and I think you very nicely touched on the sensitive topic of entitlement, Sergio, that there are perceptions around entitlement. I'm not entitled to apply for this because I stand less chances of getting that because of XZ barrier. And we should probably all try to develop a growth mindset, because unless you try, unless you knock on a door, this door is not going to open. You've got zero chances of opening that. So I love the can do attitude, and thank you for sharing that. A lot of our listeners will resonate, and hopefully they will start making these changes to their mindset to knock on more doors, even if they don't feel entitled.
Yes, yes, yes. I think if I do it one time, you can do it many times. you know.
100%.
Yes,
100%.
fully agree. Fully agree. Before we close, Sergio, we always like to end with a quick reflection round, rapid fire answers, big insights.
What is a quote that keeps you going?
Why not us? I want to say this in Spanish. ¿Por qué no nosotros? And
¿Por
that
qué
is
no
important.
nosotros?
Yes. Have
Who's the next person you hope to open a door for?
for my colleagues, because they deserve more opportunities to take part for the global oncology community.
Would you like to share something about yourself that others don't know about?
I think with this podcast, all people uh, know about my worst fears, and this is my English. This is my weakness part, and it's important that people understand that what you can do with the resource that you have. You don't you you can't expect that is always perfect, but the only that you can't do it is do anything with the resource that you have. You have to do something with the resource that you have, and that base is the base that you can use to grow about that flat base. This was my fear about talking 1 hour in English with some colleagues about me, because you have take many technicals conversation, but address this topic in English was a really a really
Well
challenge.
done. We can put this fear, we can pack that, we can forget about it.
Okay, what is the next fear that I can face? And this is important to say, because many people don't ask me about ASCO IDEA. Many people ask me about how can I do with my English applying for these kind of programs. And I always say, I don't speak anything in English until I have the opportunity to take this challenge, and the challenge through for the challenge will be a better version for you. And my advice is always about taking the challenge, facing the challenge. Is not always the opportunity that you have, but pacing, walking through the challenge, that will be developing something in the skills that you need for the next challenge, the skills for writing the next application, the conversational skills for your elevator pitch. And this is important for us in Latin America, taking the challenge, taking the challenge, taking the challenge.
Sergio, thank you for sharing your journey with us today, reminding us that resilience and advocacy are built through persistence and a deep commitment to equity. Your work shows that improving cancer care in Latin America takes both courage and collaboration. Joanna, before we close, Sergio wanted to say a few words in Spanish for our fellow Latin Americans. So, Sergio, por favor.
Creo que nosotros tenemos la oportunidad de hacer algo que realmente impacte globalmente la comunidad, no solamente de oncólogos, sino de pacientes. Y tenemos el recurso más importante, que somos nosotros. Pero junto con nosotros tenemos un paquete de recursos impresionantes. La manera como resolvemos, como enfrentamos los problemas, es realmente inspiracional para otras personas y darle voz a la manera como nosotros lo hacemos, como nosotros lo enfrentamos, es importante para la comunidad de oncología global. Y es importante que tengamos voz, pero para tener voz tenemos que tener exposición. Y exposición no solamente significa cómo me reconocen a mí, sino cómo reconocen y le damos voz a nuestra comunidad, ¿no? A nuestros pacientes que enfrentan challenge muy especiales y diferentes a los del resto de la comunidad. Y para que estemos mejor representados, los oncólogos en Latinoamérica tenemos que caminar una milla extra. No solamente haciéndolo nosotros mismos, sino trabajando en comunidad. Y esto yo creo que es lo más importante, que si no trabajamos unidos, tal vez no alcancemos esa representatividad que algún día soñamos tener. Y bueno, aquí estamos dando el primer paso, no solamente por nosotros en Colombia y en México, también por darle visibilidad a esta comunidad tan especial de personas y de profesionales que estamos aquí en Latinoamérica.
Gracias, Sergio.
Gracias. A lot for me to unpack and a lot of me to keep. One is that it's the journey that counts and life happens. There are difficulties and there are handicaps in all systems. And I know we touched slightly on inequities. There will always be difficulties and it's a matter of having this can-do attitude and try to enjoy the journey. So thank you so much. I feel very, very inspired through the conversation today. Thank you, Sergio. We will be soon meeting again to talk about other aspects that we didn't have the time to do today.
Thank you. Thank you so much for this kind opportunity to take voice for my colleagues, for take voice for my experience. I expect that anyone can learn about my mistakes and about my success. I don't know, maybe we have another opportunity for talk about more topics, for more awards, I hope, and for the opportunity for my patients to be in clinical trials. That is my main goal, about to take this challenge, for be better represented in clinical trials. And I want to make something for my patients, for my community, for the patients that don't have any opportunity to be in a clinical trials. And thank you for hear my voice, for hear my dreams, and I hope to take another opportunity for talk with you.
Thank you for coming, Sergio.
And to our listeners, keep opening doors for yourselves and others. This is Dr. Joanna Nixon.
I am Dr. Vilma Pacheco Barcia from Open Doors Podcast.
And remember, you belong in the room.
You belong in the room.